think the whole issue is about improving access for people that are injured in Florida. And in 2010, they showed that the average mortality for trauma in the state of Florida is actually higher than the national average. That was produced by the Department of Health. Since we've added the trauma centers in Florida and looked at the 15-month outcomes, we've shown that we've actually improved. There's a positive associated improvement in mortality and length of stay. And for the trauma service areas that all of these new centers have treated residents and injured residents in, there's been a significant statistical decrease in mortality, complication rate, and length of stay. In my area in Ocala, we've treated well over 2,000 patients, which is a lot of patients. That's more than what people expected. And there was concern from nearby trauma centers that they would lose significant volume. We're not really seeing that. So what that tells me is that what we've really done is improved access for that area in a much needed area. The state of Florida in general is doing better because of the new trauma centers. Mortality rate has decreased. We've shown this all across the country, San Francisco, Washington, D.C., Naples, Florida, and reported our results in terms of the positive benefits of all these trauma centers for injured people that either live in our state or visit our state. So I think those are pretty compelling reasons to have these centers here, because we're saving lives.
What do you think about this argument on the other side that these new trauma centers hamper the ability of the existing trauma centers to effectively operate?
I think, if you theoretically think about that, that is a plausible possibility, but in reality, if you look at the data, I don't think anyone's outcome is really suffering because of the new trauma centers that have come up. And actually, if you look at the subset of patients, geriatric patients, we did a study and we showed that there was an aggregate increase of 1.2% of geriatric patients being treated at non-USF/HCA trauma centers within the network. And those patients actually improved in their outcomes as well in terms of mortality, length of stay, complication rates. The state of Florida has a long history of showing that there's been improvement in terms of patient outcomes as you've carefully added trauma centers in areas. And I think that's why this is so important to talk about apportionment. Where do we put new trauma centers? How do we best benefit patients and their needs based on injury? And this is why we're all trying to get together on a table. Hopefully you'll see today that we agree on a lot of key things that are important for patient care. And there'll be some things that are subtly that we don't see eye to eye to, but at least there's an open dialogue. And I think that's important. That's important that the state of Florida is doing that. And it shows that they're earnestly trying to come up with a solution that's tenable, not just for the people of Florida, but also the hospitals that sort of serve those people.
I'm not opposed to new trauma centers, but I do not want the current trauma system to suffer. And Florida arguably has one of the most established trauma systems in the country, and it's based upon regionalizing specialized care. Now, one might ask, what's the purpose of a trauma center? Well, a trauma center, a level 1 trauma center and level 2 trauma center have different purposes. Both are to provide quality care, and there's a certain volume of severely injured patients that you need to see to have maintain those skills. And the number that we're throwing around here is something called injury severity score. Greater than 15, you need to have 650 patients a year. Now, what is the purpose of a level 1 trauma center in distinction to a level 2? Well, it has the obligation to educate and to do research. And if you don't have a certain volume of severely injured patients that are coming into a center, you can't maintain your education, and you certainly can't do research. And what's happening with the opening of some of these level 2 trauma centers is that the ISS over 15 is going down. The total trauma volume isn't changing as much, but the severely injured patients coming into these big centers is going down. Now, having said that, I think the state has an obligation to assess its trauma areas and decide where there's deficiencies, and then open up trauma centers as they can. Now, what's kind of interesting is that a decade ago you couldn't get anybody to volunteer to be a trauma center. Now people are figuring out how they can make money doing it, and so they're making a lot of money off of trauma patients. And our contention is the quality of care is not increasing, the cost of care is increasing, which is just the opposite of what we're supposed to be doing in the current healthcare debate.
To the factors that actually determine. So, to me, if you look at the fact that a population.
The director there, and also the director of research and quality for the USF.
Fellow pediatrician trying to cover that, and then also covering care.
Next to each other in the middle of a very populated area.